Hi, everybody. This is Dr. Eliana Aaron, Director of EMA Care. I hope everyone is doing well. Today, I'm going to talk about some of the new alleviation of restrictions that has happened in Israel and how that impacts specifically gap year students, either in Israel or people trying to come back, whether residents or tourists or things like that. I'm also going to talk about some of the trend issues that are going on and how that can impact globally the decisions that politicians are making and how the decisions that politicians are making are impacting the epidemiology of countries. I'm also going to talk briefly about a new phenomenon that's been reported in medical journals and also in the press, actually, the mainstream press, about an inflammatory condition that is being seen in children, very rarely, but is being seen in some children who are recovering or have recovered from coronavirus that they believe is as the result of the coronavirus. And there have been some children that have died of this inflammatory condition. So first of all, I'm going to talk about the restrictions that have opened up. So today they announced, today is May 11th, they have announced that the mandatory quarantine in hotels is now over. People are able to quarantine at home. What does home mean? Home is defined as being able to prove that you have a separate residence, apartment, or room with a private bathroom that you are able to then quarantine in and have your needs met in that location. In theory, this can include an Airbnb situation, as long as you're able to order food in and you can stay locked in. Anyone who is found to be violating quarantine is going to be shipped to a hotel. So it really, and they will be monitoring these situations. So very important that you are honest with the way that you report to the government where your quarantine is and to register appropriately through the Ministry of Health website. So that's a really good thing. That's a good step in a good direction. That's where we want to go as far as gap year, not just for this year. Some programs are trying to salvage this year, and there are hundreds of parents out there who want to send their kids back. What's holding us up now is that the students' visas are still lumped together with tourists. So until we are able to separate that and make sure that it's recognized that students who come for a year of learning or 10 months of learning or even a semester of learning should be treated differently than tourists that come for 10 days or 2 weeks. So we really need that to happen. We're working now to try to find a solution for that problem. It seems like it should be simple, but it's not, because again, the number of students we're talking about relative to the population is just not that high, and people aren't paying attention to this group. The fact is that out of the hundreds of kids that we have helped directly or indirectly through the programs and the protocols that I've developed with my team, not a single gap year student got sick in Israel, and there have been lots of kids in quarantine, and almost every school had some level of quarantine at some point, and we were able to keep these kids safe with our protocols. So that should be evidence that if schools are able to maintain the protocols, that their kids are most likely to be safe and not be a burden on the healthcare system. So, and of course, keeping them safe is a reward unto itself. So those are some of the things that we are really hoping to push forward, and that's the piece that's missing. Politics is politics, and we hope we are able to do it quickly. I'm going to show you now. The other thing that opened, is public parks have opened, national parks have opened, outdoor spaces have opened up. And I believe that includes zoos, safaris, and things like that. I know there are some programs that are already taking kids away for the weekend into private, not Airbnb, but private sort of bed and breakfast type places where there won't be anybody else there, and the kids could actually get out and have some freedom and see some nature, which will be really nice. So that's already going on. Some of these TLM, the programming is continuing to develop, and I think it's going to, again, be, it's going to become much more normal than it has been, and we're very excited about these developments. Lag BaOmer this week is going to be shut down. There is no campfires allowed, no bonfires allowed, no fires are to be lit for the period of time, like several days before until the day after, because they just don't want people gathering around and being close together. Again, what we know about the trends that we have seen internationally is that holidays, whether formal or informal holidays, cause an uptick. And what the government is doing is they are suppressing that uptick by limiting activity legally that's allowed on those days. So this has been shown to be helpful and useful. We compare Purim, which is an informal holiday, to Pesach, that is a very formal holiday. And then we continue on to Yom HaAtzmaut, where there wasn't a bump. There's no bump from Yom HaAtzmaut. We did well. Everything was shut down. It was not a formal holiday. Lag BaOmer is not a formal holiday, but that's why we need to be doing this, to make sure we don't get that bump right back. Okay, so now I'm going to quickly share my screen and just show you the trend that we discussed before, which is the trajectory of world COVID cases. And this basically is showing us some of the trends. And I think it's important, once again, to understand that this is a logarithmic scale. That means that between each major set of numbers here is times 10. So you go from 10 to 100 to 1,000 to 10,000, and it's not evenly spaced. So the reason why this is important is to catch long-term trends and to see in which direction, instead of looking at the everyday minutia, to really look at this more widely, to look for trends. And this is extremely important in determining, and I have to thank my son-in-law, Nathaniel, for showing me this website. But what's really significant here, and I've been saying this all along, is we should not be looking at the day-to-day anomalies, trends. It needs to be looked at on a wider scale, which is why a lot of these, charts that I produce are long-term charts, where you're looking at a month or 2 months, so that you could kind of see the perspective a little bit. And I also do a lot of cross-country comparisons. So what you have here is the newly confirmed cases in the last week. Because again, you can have one day with 20 and one day with 500, and neither is extremely significant. You got to look at the larger trend. So each of these is also logarithmic, meaning, again, times 10 each way up. And not too many countries have had this many. I mean, here we have the United States that clearly has the most cases in the world, or had the most cases in the world. But what you can see here is America did actually surpass the 100,000, actually the 200,000 mark at some point per week. So that's very important to note. Why is this important? I'm going to quickly play this for you so you can see over the period of time how these select countries, I pick these countries, I can pick any countries, but how they're doing, how they've done, and what the trend is. So if you take a look here, what happened is you can see Europe, going straight up that curve, and that curve is really where you have exponential growth. This angle here is extremely high. What we also see is that when there's a downturn, meaning that, what does a downturn mean? Downturn means that you're not getting a huge number of cases, not enough to really manipulate this way. You're not getting a lot of new cases, but you are also dropping in the number of confirmed cases per week. And that means that you go straight down. So if you take a look at, let's look at Belgium. Belgium is in a nice, good place. You can see the line for Belgium. Belgium was going straight up. They were not doing well, and they've had a lot of deaths. They have not done well. But what we see is there was some kind of a turning point here where the trend started going down, and they went from 6,000 cases in a week down to 3,000 cases in a week. And as this number keeps going down, we're going to be able to track, are we really lowering our numbers here? What we do know is that with 3,000 cases in a week, they're barely going up past this 50,000 mark. So that means that in the last week or so, they really haven't been getting a lot of cumulative cases. And that's a good trend. That means that we're slowing down. In Israel, you can see, and last time I showed this to you, Israel was like way up over here, but we really knew that we were going down. But we went basically from over here, where Israel had a total of weekly cases of almost 2,000, to right now at 269. So that means Israel is barely, going past the total numbers that we have, because again, this is logarithmic. So each one of these is actually thousands. But what we also know is that our weekly accumulative cases is stabilizing and dropping very quickly, and that's very exciting. What happened here in Spain is interesting, because Spain actually went straight down. Okay, Spain went straight down. So all the way down here, they only had 400 cases. This is on April 30th. This was 11 days ago. And then what you see is that it spiked right back up. So if you go to today, for example, actually this is on the 7th, it went back up to 8,000. And what happened here is that things open up too quickly. People run out, they go to the mall, and they are mixing and mixing, and all of a sudden their caseload per week doubled in a week. So that's like a rebound effect of opening up too quickly. Now, England announced today, the United Kingdom announced that they want to start opening up the economy again. Now let's take a look at England real quick. England has not started trending down. What we see with these countries is that you kind of go up, and then you're having this trend of kind of holding in a certain place as you progressively get more confirmed cases, and then you start to go down. And England has not yet gone down. The weekly confirmed cases has been 33,000. I mean, that's a ridiculous number. So I think that is also probably premature. We can see Russia has gone up tremendously. They are really in bad shape. They've had 75,000 cases in the last week, and they're going up about 10,000 cases a day. America, as you can see here, is on that flattened part of this particular type of curve, but has not yet started dipping down. So they still have 177,000 cases per week at this point. But what we do see is once you have this flattened area, you know that unless something major happens, and I know the economy is opening there, that this should start to drop down. But America has 50 different states with 50 different points of legislation and regulation, so it's very difficult to measure the United States compared to other countries. Really, each state should be measured as a separate country because they have different rules. So I wanted to just show some of that to you. I'm going to stop sharing that now. Okay. The other thing I wanted to talk about is what's going on with these children. This is a new virus. This is a virus very different than other coronaviruses that have existed in humanity that we have studied, such as MERS and SARS. So we don't know the long-term effects of what happens when people get this disease. Right now, we believe that many people get this disease, have a mild form. Some people don't even know they're sick. Most people don't even know they're sick. The degree of how much they can spread it when they're not symptomatic or mildly symptomatic is still up for question. We're not sure about that yet. What do we know? We know that there are people who have recovered who are able to be infected again. We do not believe necessarily that there's immunity. We also believe that when you have a situation like this, a lot of things end up showing up later. We know people have left the ICU with permanent lung damage. We know that people have had long-term effects neurologically. Is this individuals or is this a larger trend? Has yet to be seen, even though there are 4 million cases in the world. There are many, many major research projects going on. I'm not talking about a hospital reporting on 20 cases, which is what we relied on when it was March. But now we're not relying on those anecdotal evidence points anymore. We're really looking for larger trends. It's still early. There are countries like England where out of all of the cases that they've had, the few that have recovered, very few have recovered. Less than 3% of the people in England who have resolved their cases of COVID have actually recovered. The rest of them have died. So we have to wait a few more weeks to even see how some of those countries recover and what the recovery rate is, and then what are the long-term effects. So what's going on with these children is they have this very strange combination of effects. They're calling it a cross between Kawasaki disease and toxic shock syndrome, and they develop systematic, multi-systemic inflammation, and some of these kids are dying and they're getting sick, and we don't know why. What does this mean for us? We don't know yet. What we do know is that the people who say, that's it, I'm done, my kids can't stay home anymore, they're sick and tired of being in the house, get them out, let them play with their friends, they're not going to really get sick anyway, they're going to be fine, and even if they get it, nothing bad's going to happen. There are parents who are saying this. We have heard it firsthand. And while we understand the frustration of staying closer to home and keeping your kids away from their friends, we also know that, you know, if we discover that there are, in fact, statistically speaking, long-term effects that kids can get, and that a certain percentage of kids can die even after they've had the disease, then saying that you can't handle the kids at home and that they're tired of it is potentially harming other children, not just the old people, not just the grandparents, but also the children. And once children are dying and children are getting sick, people tend to be a little more sensitive to that. So I would like to think that people will start thinking about that before they send their kids out to play with their friends on bikes outside. So I think this is very important to consider. We don't have all the answers yet. We don't have a lot of answers yet at all. But I also know that there seem to be a lot of long-term effects that we don't know, and I don't want us to be responsible for causing that kind of harm to people at all, whether they're elderly, whether they're children, whether they're babies, whether they're young, healthy adults. What we do know is that most people who have coronavirus are in their teens and 20s, and they're the ones who end up spreading it to the people who end up dying. Whether it's young children from this mystery inflammatory disease or elderly people, I don't want anyone to be responsible for that. I want everyone to, when the economies open up, take it slowly, take it easy. We can live without the mall most of the time. There's Amazon, well, not in Israel anymore, but we can do other things. We've lived without it. So if you need to go to the bank, go to the bank. You need to go to the pharmacy, go to the pharmacy. You need to go and get a pair of shoes because your kid doesn't have shoes anymore. I understand that. But I want to go schmooze with my friends. I mean, that's a luxury, and I know that it's important, but maybe it's a little too early, my opinion. Take care. Please stay home as much as you can. Stay safe. And please, please take care of yourselves, your neighbors, and your community.